This is Dr. Gardner, and I will be lecturing on sleep-wake disorders, Nursing 590 to 692. Okay, so I was wondering what was going on with my slides, but here it is. Okay, so let's move into sleep-wake disorders. There is insomnia, hypersomnolence, narcolepsy, breathing-related sleep disorders. There's the circadian rhythm. We'll talk about non-rapid eye movement or REM sleep, behavior arousal, nightmares, rapid eye movement, sleep behavior or REM, restless leg syndrome, and substance or medication-induced sleep. So what are the sleep stages? There's different stages. Well, REM is the typical story-like dreams occur during REM, and that occupies about 20 to 25% of total sleep. Non-REM, that's deep sleep stage 1, is a transition from wakefulness to sleep, and it occupies about 5% of time spent asleep in healthy adults. There's the non-REM sleep stage 2, and that occupies 50% of time spent asleep. There's non-REM sleep stage 3 and 3. That is a slow wave sleep. It's the deepest level of sleep, and it occupies about 20% of sleep time in healthy younger adults. So we have REM. Remember, REM is a typical story like dreams occur during REM, and that's about 20 to 25% of your sleep. Then you have non-REM, 3 stages. There's N1, N2, and 3. Sleep stage 1 and 1, sleep stage 2 and 2, and sleep stage 3 and 3. Remember, sleep stage 3 is the deepest level of sleep, and that occurs in about 20% of the sleep time in healthy younger adults. The majority of sleep time is spent in sleep stage 2. So, sleep stages. When people complain or they have issues, we want to know, do they have difficulty initiating sleep? Do they have difficulty maintaining sleep? Do they have a restless sleep? Are there early morning awakenings where they can't go back to sleep? Sleep disturbances cause clinically significant distress or impairment in social, occupational, educational, academic, behavioral, or other important areas of functioning. So this is not just difficulty sleeping one night and then, okay, you get your sleep again. Maybe something happened. Maybe you got a bad phone call. You weren't able to sleep. This is a person who is lacking sleep for so long that that disturbance begins to cause an impairment in functioning. Sleep difficulty occurs at least 3 nights per week. So when you're assessing your patient, you need to ask them, how many times are you having trouble sleeping during the week? Is it once? Is it every other night? Is it at least 3 nights a week? Sleep difficulty also has to be present for 3 months before a diagnosis is made. So you want to know, are you having trouble falling asleep, staying asleep, restless sleep? Are you waking up, you can't go back to sleep? How many nights are you having trouble sleeping? and how long has this been going on. Also, sleep difficulty occurs despite adequate opportunities for sleep. So that's when you want to make sure your patient is doing what they need to do, practicing sleep hygiene to go to sleep. So if they have an opportunity to turn the lights out, cool the room down, put the phone away, no television, it's time to go to bed. Are they able to then go to sleep, or are they having trouble falling asleep, staying asleep, maintaining their sleep, restless sleep? Sleep stages. That sleep disorder is not better explained by another sleep-wake disorder. It's not attributable to physiologic effects of a substance like drug use or medication. Coexisting mental disorders and medical conditions do not adequately explain the predominant complaint of insomnia. So when I talk about not attributable to physiologic effects of a substance or like drug use or medication, example, cetirizine. Most people can take cetirizine, 10 milligrams, also known as Zyrtec, in the morning and function all day long. However, some people cannot. I am one of those people who cannot. If I take a 10 milligram of Zyrtec, it's going to probably almost knock me out. So I take it one night, I can function, and so I'm able to function during the day, but then I'm so drowsy from this medication and it has an effect on my sleep. If I would take this every night for a week, then I may experience some kind of hypersomnolence where I can't get up. So then that is not hypersomnolence from um, some other condition, it's medication induced. So you need to know, are they taking something? Maybe somebody with insomnia is taking a stimulant. Maybe they're on Adderall and they take their Adderall too late at night. Then they cannot sleep. And they take this Adderall every night too late and they're not sleeping. So you have to find the cause of their insomnia. The cause of their insomnia is the medication. Get it? Okay. So let's talk about parasomnia. What is parasomnia? That is complaint of unusual behavior or events during sleep that may lead to intermittent awakenings and difficulty resuming sleep. This is often seen or as in sleepwalking, is what we've heard. So parasomnia is associated with sleepwalking. Hypersomnolence disorder, that's excessive sleepiness despite a main sleep period lasting at least 7 hours. So they had a whole night's sleep, they were able to sleep 7 or 8 hours, but they're still so sleepy during the daytime. They still can't stay awake. Well, we need to investigate. And this is a good point about knowing your assessment. So, what are some of the reasons someone may have hypersomnolence? I want you to think about that. Do a little bit of research. So, remember, this person has had a full night's sleep, but they wake up in the morning. They may still be feeling tired. They still have periods of wanting to sleep during the day, even though they slept all night. Some sleep wake pearls. 25% of children will suffer from a sleep problem. Quite a bit, isn't it? For children, that 25% are going to suffer from a sleep problem. Orexin is said to have an increased effect on the sleep-wake cycle. So, what is it that has that effect? It's orexin. Persistent insomnia in children may be a sign of emotional distress. So these children need to be evaluated because you have to start wondering what is it that is causing these children to have trouble sleeping? Some survey instruments that are used for assessing sleep would be a sleep disturbance scale in children, child and family history questionnaire, sleep disorder inventory for children, sleep diaries. If you request a sleep diary from your patient, you want at least 2 weeks of logs. In the Epworth Sleepiness Scale, the modified version is also very good at assessing your sleep disorders in children. So, what's the treatment? First, we want to educate them. Good sleep hygiene and behavioral interventions are first-line treatments for pediatric insomnia. Educate them. Good sleep hygiene, behavioral interventions. You're going to do that before you give a child medication for sleep. You should do that even with adults. So, what do we want to tell them? We want to have stimulus control, remove the clocks, the cell phones, maintain a quiet sleep environment. They want to need to practice sleep restriction, limit the amount of time in bed until the child is sleeping 90% of the time. The circadian rhythm, going to bed and awakening at the same time. Children need a schedule. Adults need a bedtime schedule. If possible, have that child in bed 8 or 9 o'clock every single night. Do their nighttime routine in bed by 8 or 9. Have a time that they wake up. Wake up at 7 or 8 to go to school. Make that a routine early so they practice that circadian rhythm. Cognitive distortions are things you want to address, like the catastrophizing. If I don't go to bed soon, I'm never going to sleep. If I don't go to bed soon, I'm going to be a wreck. So you want to address cognitive distortions if they can't sleep. That no, if you don't go to bed soon, then you will be able to go to sleep, but let's try and see what we can do to get you in bed. And arousal reductions, relaxation techniques such as belly breathing and biofeedback. So that's all a part of educating. You want to give the parents good guidelines on how their child can better get sleep. Now, as far as medication, there's really no FDA approved medications for children. However, melatonin can be used and clonidine can be used for children to sleep. Okay, and that is the end of sleep-wake disorders. That is all I have for now. If I decide to add before the exam, you will get another lecture. That's it for now. If you have any questions, let me know.